We've talked about different treatment options for the management of constipation. Then there are a couple of specific conditions. As remember, we mentioned that if that sphincteric muscle of the rectum is not relaxing and as she's straining down, well, that could be a problem that cannot be solved with medication. So we have to solve at that end level. And that is where our physical therapist gets involved, and a patient needs to be put through proper education of what is the mechanism of relaxation of the sphincter. She needs to be showed how to relax the sphincter, and that is what our physical therapist works with the patient and helps her try to relax that sphincter gradually. It takes time, but with physical therapy, the sphincter can be relaxed, and then she shows her how to expel the balloon, and she works on abdominal contraction, relaxation of the pelvic floor to expel the balloon out. So that is for the dyssynergia, or where the rectal sphincter is not relaxing. The other is a condition which is, as I mentioned, a rare condition, the slow transit constipation. And in cases of slow transit where, medications may not work, because remember, the good news is that most constipations are the normal transit constipation. But in slow transit constipation, the bowel may have to be removed. And that may be the only recourse. We cut out that large bowel and connect the cecum to the rectum. So it may sound like a radical step, but if someone is completely bothered by constipation, is struggling to have a bowel movement, she would be excited just to have a normal bowel movement, even though she would have to go through a surgical procedure. The other thing that can be considered is a high volume enemas. So in certain cases, we'll tell our patients to give themselves an enema, which is a large volume of water that they put in until they get a bowel movement. So there are still some options available for those other cases of constipation which are difficult to manage. All in all, constipation is a vexing problem. It happens in a large number of women. At least 30% of women over the age of 65 have constipation, and they are using laxatives left, right, and center. It is very important that when they come to us, we know exactly how to make the right diagnosis. We make sure what the medications they're taking, what medical diseases they have, and we appropriately put them on the right path to treatment. Most patients with constipation can be taken care of right in our office.